timing affects sleep quality. Caffeine consumed in the afternoon or evening disrupts sleep onset and quality. Alcohol consumption in the evening worsens sleep quality even though it might initially make you drowsy. Avoiding caffeine after 2 p.m. and limiting evening alcohol consumption improves sleep. Exercise supports both sleep quality and acne management through multiple mechanisms. Regular aerobic exercise, 30 minutes, 5 times weekly, improves sleep quality, reduces stress, regulates hormones, and improves acne. However, exercising too close to bedtime, within 3 hours, might disrupt sleep. Exercising earlier in the day optimizes both sleep and acne benefits. Sleep-specific skincare involves protective measures during sleep. Applying a heavy, occlusive moisturizer or night cream before bed protects skin during nighttime and supports barrier health. Night creams are often richer than daytime moisturizers because you don't need to worry about appearance or mattifying for makeup. Overnight hydrating masks provide intense hydration during sleep. Some people use occlusive oils, just a few drops of facial oil over moisturizer, to lock in maximum hydration overnight. Retinoid application at night leverages sleep's restorative processes. Applying retinoids in the evening, or before bed if your routine allows, means they work while your skin undergoes growth and repair during sleep. This timing often provides better results than morning retinoid application, though this varies individually. Acne spot treatments can be applied before bed to work overnight without interfering with daytime activities. Leaving benzoyl peroxide or other treatments on overnight provides extended contact time for therapeutic benefit. Silk or satin sleep masks or pillowcases are promoted for anti-aging and acne benefits. The reduced friction might slightly reduce acne, and the reduced moisture absorption compared to cotton might help slightly, but these effects are modest compared to other acne management strategies. If you like the feel of silk pillowcases and can afford them, they're worth trying, but they're not necessary for acne management. Optimizing sleep requires a multifaceted approach, maintaining 7 to 9 hours nightly, keeping consistent sleep schedules, avoiding evening screen use, limiting caffeine after 2 p.m., maintaining cool, moderate humidity bedroom, and changing pillowcases frequently. These changes take 2 to 3 weeks to impact acne, but most people notice significant improvement in acne after optimizing sleep long-term. Sleep is one of the most underrated acne management strategies. While topical treatments and professional treatments receive most attention, sleep optimization often provides dramatic acne improvement that rivals pharmaceutical treatments. Prioritizing sleep is one of the highest impact acne management strategies available. Guide 35, Water Quality, Hydration Science, and Optimal Water Intake for Clear Skin. While "drink water for clear skin" is commonly repeated, the mechanisms behind water's role in skin health and the specific amount of water actually needed for acne improvement are often misunderstood. Understanding water science and optimal hydration supports acne management. The myth that specific water quantities, 8 glasses daily, etc., directly treat acne is oversimplified. While adequate hydration supports overall health and skin function, consuming excessive water beyond your actual hydration needs doesn't further improve acne. However, maintaining proper hydration throughout the day supports skin health in multiple ways. Dehydration compromises skin barrier function. When your body is dehydrated, your skin compensates by producing more sebum to maintain oil barrier protection. Paradoxically, Dehydrated acne-prone skin often appears oily while being dehydrated internally, creating conditions promoting acne. Proper hydration reduces this compensatory sebum production. Hydration supports skin cell function. Skin cells require water to function optimally. Proper hydration maintains cellular processes, supports detoxification, and promotes overall skin health. Dehydrated skin appears duller and is more prone to irritation and breakouts. Hydration supports immune function. Adequate hydration maintains lymphatic function and immune cell circulation, supporting your body's ability to fight acne-causing bacteria. Dehydration compromises immune function, potentially worsening acne. Hydration supports blood circulation. Well-hydrated blood flows more efficiently, delivering nutrients and oxygen to skin cells. Dehydration compromises circulation, reducing nutrient delivery to skin. Optimal daily water intake varies based on body weight, activity level, climate, and individual factors. A general guideline is 35 milliliters per kilogram of body weight daily. For a 70 kilograms person, this equals approximately 2.5 liters, about 10 glasses, daily. However, individual needs vary significantly. Thirst is a reasonable indicator of hydration needs. Drinking when thirsty and monitoring urine color. Pale yellow indicates adequate hydration, dark yellow suggests dehydration, guides appropriate intake. Individual variation in optimal water intake is substantial. Some people need 2 liters daily for optimal hydration, while others need 3 to 4 liters depending on activity and climate. Rather than following a rigid 8 glasses recommendation, assess your personal hydration status and drink accordingly. Water intake timing matters somewhat. Distributing water intake throughout the day maintains consistent hydration better than consuming large amounts at once. However, excessive water intake shortly before bed disrupts sleep through nighttime urination. Tapers off water intake 2 to 3 hours before bed to optimize sleep quality. Electrolyte balance matters for hydration beyond pure water intake. Excessive water intake without sufficient electrolyte intake, sodium, potassium, magnesium, can disrupt electrolyte balance, causing problems. Consuming electrolyte-containing beverages or foods alongside water maintains balance. However, the Western diet typically contains adequate sodium, so electrolyte concerns are minimal for most people unless they're exercising extensively or sweating significantly. Water quality affects skin and acne through multiple mechanisms. Hard water, high mineral content, leaves mineral buildup on skin, potentially irritating it and compromising cleansing efficacy. Soft water cleanses more effectively. If you have very hard water, installing a water softener or using a shower filter might help. However, evidence for hard water directly worsening acne is limited. Chlorinated water can irritate acne-prone skin. Chlorine is drying and potentially irritating. Using filtered water for cleansing if you have highly chlorinated tap water might help. However, most chlorine in tap water is minimal and unlikely to significantly impact acne. Hot water is more drying to skin than lukewarm or cool water. Cleansing with lukewarm water rather than hot water reduces water-related dryness, particularly important for acne-prone skin already potentially compromised by active treatments. Distilled water versus tap water has minimal practical difference for skin health. Distilled water is free of minerals and chlorine but also lacks beneficial minerals. hormonal surge of LH and FSH. Some women experience minor acne worsening around ovulation. The luteal phase, days 15 to 28, involves rising progesterone and maintained estrogen. This phase often brings worsening acne in hormone-sensitive women due to progesterone effects and androgen to estrogen ratio changes. Tracking your acne patterns against your menstrual cycle for 2 to 3 months reveals your personal pattern. Many women find breakouts clustered in the luteal phase, particularly the 5 to 7 days before menstruation. However, individual patterns vary significantly. Some women have no cyclical acne pattern, while others have severe luteal phase breakouts. Once you identify your cyclical pattern, strategic treatment timing can optimize results. If you break out mainly in the luteal phase, intensifying acne treatment frequency during this phase can prevent significant breakouts. For example, if you normally use salicylic acid 2 to 3 times weekly, you might increase to daily use during your high-risk luteal phase. This temporary intensification often prevents the severe breakouts that would otherwise occur. Planning professional treatments around your cycle optimizes results. Having a chemical peel or professional facial during your clear follicular phase when your skin is less inflamed and more resilient provides better results than during your breakout-prone luteal phase. Hormonal contraceptives can help by suppressing ovulation and stabilizing hormone levels. Many women find that switching to birth control pills with continuous hormone dosing, tricyclic or extended cycle pills that reduce or eliminate placebo weeks, significantly reduces cyclical acne by preventing the hormonal fluctuations driving breakouts. Spironolactone, antiandrogen, helps some women with cyclical acne by blocking androgen effects. However, effects are more modest for pure cyclical acne than for chronic hormonal acne. Dietary modifications might help cyclical acne through hormone metabolism. Some evidence suggests that supporting liver health through adequate nutrients supports estrogen metabolism. Consuming adequate B vitamins, magnesium, and fiber supports hormone metabolism. PMS supplements containing ingredients like calcium, magnesium, and vitamin B6 might help with luteal phase acne through their effects on hormone metabolism and inflammation. Some women find these supplements modestly helpful. Stress during the luteal phase exacerbates acne in many women. The luteal phase naturally involves slightly increased anxiety and mood sensitivity. Implementing additional stress management during this phase, extra exercise, meditation, or relaxation practices, can reduce acne by controlling stress hormonal interactions. Sleep quality often decreases in the luteal phase due to progesterone effects. Prioritizing sleep during this phase through good sleep hygiene, potentially with earlier bedtimes, supports skin health. Understanding your cyclical acne pattern allows realistic expectations and strategic planning. Rather than being frustrated by predictable breakouts, you can anticipate them and proactively manage them. This empowerment often improves both skin outcomes and psychological well-being around acne. Guide 52, Acne Cosmetica, Product-Induced Acne and Ingredient Avoidance. Acne cosmetica specifically refers to acne triggered or worsened by cosmetic products. Understanding this condition and identifying problematic ingredients prevents wasted time and money on ineffective acne treatments when the actual problem is product-induced acne. Acne cosmetica differs from typical acne in that stopping the offending product often resolves it completely, whereas typical acne persists despite good skin care. This distinction is diagnostically important. If your acne improves dramatically after discontinuing a specific product, acne cosmetica was likely the cause. Common culprits in acne cosmetica include foundations, particularly heavy, silicone-based ones, primers, concealer, powders, sunscreen, and heavy moisturizers. These products can clog pores through their occlusive nature or irritating ingredients. Specific ingredients commonly triggering acne cosmetica include dimethicone, silicone oil, talc, isopropyl myristate, emollient, and certain botanical extracts that are irritating to acne-prone skin. Coconut oil, for example, is comedogenic for many acne-prone individuals despite being natural. Testing for acne cosmetica involves systematic elimination. If you suspect a product is causing acne, stop using it for 2 to 3 weeks and assess whether your acne improves. If it does, the product was likely responsible. Then reintroduce the product to confirm, though this re-triggers acne and can be frustrating. This elimination challenge approach definitively identifies culprit products. Non-comedogenic labeling helps identify acne-safe products, though labeling is not FDA regulated and varying definitions exist across brands. Non-comedogenic products are still not guaranteed safe for all individuals, but they're formulated to minimize pore clogging risk. For confirmed acne cosmetica, switching to acne-safe alternatives of the product category often resolves the issue. Switching to non-comedogenic foundations, powder-based makeup instead of cream-based, or lighter formulations often allows makeup use without acne worsening. Reading ingredient lists helps identify potentially problematic components. Becoming familiar with ingredients triggering your personal acne helps you avoid them. Some people maintain lists of problematic ingredients to check against when considering new products. Patch testing new products on a small area, behind your ear or on your jaw, before full face application helps identify problematic products before they cause widespread acne. This 1 to 2 week trial prevents wasting money on products that trigger acne. The relationship between acne cosmetica and other acne factors is important. Someone might have both hormonal acne, from internal factors, and acne cosmetica, from products. Addressing both simultaneously, using acne-safe products plus treating hormonal acne medically, provides the best outcomes. Makeup artists and dermatologists can recommend acne-safe product alternatives for people who require makeup professionally. Many professional-grade acne-safe makeup lines exist specifically for people needing makeup without triggering acne. Guide 53, Acne Mechanica, Friction and Pressure-Related Acne. Acne mechanica results from friction, pressure, or occlusion of skin and can be prevented through environmental and behavioral modifications. Understanding acne mechanica helps you prevent this preventable form of acne. Acne mechanica appears where friction or pressure occurs, under helmet straps, where backpack straps compress skin, where tight athletic equipment contacts skin, or where repetitive hand-face contact occurs. This acne is localized to pressure-bearing areas rather than distributed across the face. Friction from repetitive skin-on-surface contact, athletes rubbing faces on towels, workers constantly resting their faces on hands, can trigger acne through mechanical irritation and follicle disruption. Occlusion, trapping sweat and bacteria under non-breathable materials, creates ideal conditions for acne. Wearing tight, non-breathable clothing or equipment increases acne in that area. Prevention strategies include wearing loose, breathable clothing, ensuring athletic equipment is clean, using protective barriers, adhesive taping where possible, between skin and friction sources, and maintaining good hygiene in high-friction areas. Post-exercise hygiene is crucial for athletes. Showering immediately after exercise, changing into clean clothes, and cleansing areas where equipment contacted skin helps prevent friction acne. Some athletes find that using antiperspirant before exercise reduces sweat-related friction and bacterial growth. Hairstyles causing friction, tight braids, tight buns, can trigger acne on the scalp and forehead. Occasionally loosening hairstyles, using gentler hair-holding methods. Consistent routines in consistent order reduce sensory overwhelm. Number 50 Specialized Skin Care and Acne Treatment Guides, Part 4. Each guide, 10 to 15 minutes reading time. Guide 51, Acne During Menstrual Cycle, Tracking, Prediction, and Strategic Treatment Timing. Understanding how your menstrual cycle affects acne allows you to predict breakouts and strategically time treatments for maximum effectiveness. This is particularly valuable for women with cyclical hormonal acne. For confirmed acne cosmetica, switching to acne-safe alternatives of the product category often resolves the issue. Switching to non-comedogenic foundations, powder-based makeup instead of cream-based, or lighter formulations often allows makeup use without acne worsening. Reading ingredient lists helps identify potentially problematic components. Becoming familiar with ingredients triggering your personal acne helps you avoid them. Some people maintain lists of problematic ingredients to check against when considering new products. Patch testing new products on a small area, behind your ear or on your jaw, before full face application helps identify problematic products before they cause widespread acne. This 1 to 2 week trial prevents wasting money on products that trigger acne. The relationship between acne cosmetica and other acne factors is important. Someone might have both hormonal acne, from internal factors, and acne cosmetica, from products. Addressing both simultaneously, using acne-safe products plus treating hormonal acne medically, provides the best outcomes. Makeup artists and dermatologists can recommend acne-safe product alternatives for people who require makeup professionally. Many professional-grade acne-safe makeup lines exist specifically for people needing makeup without triggering acne. Guide 53, Acne Mechanica, Friction and Pressure-Related Acne. Acne mechanica results from friction, pressure, or occlusion of skin and can be prevented through environmental and behavioral modifications. Understanding acne mechanica helps you prevent this preventable form of acne. Acne mechanica appears where friction or pressure occurs, under helmet straps, where backpack straps compress skin, where tight athletic equipment contacts skin, or where repetitive hand-face contact occurs. This acne is localized to pressure-bearing areas rather than distributed across the face. Friction from repetitive skin-on-surface contact, athletes rubbing faces on towels, workers constantly resting their faces on hands, can trigger acne through mechanical irritation and follicle disruption. Occlusion, trapping sweat and bacteria under non-breathable materials, creates ideal conditions for acne. Wearing tight, non-breathable clothing or equipment increases acne in that area. Prevention strategies include wearing loose, breathable clothing, ensuring athletic equipment is clean, using protective barriers, adhesive taping where possible, between skin and friction sources, and maintaining good hygiene in high-friction areas. Post-exercise hygiene is crucial for athletes. Showering immediately after exercise, changing into clean clothes, and cleansing areas where equipment contacted skin helps prevent friction acne. Some athletes find that using antiperspirant before exercise reduces sweat-related friction and bacterial growth. Hairstyles causing friction, tight braids, tight buns, can trigger acne on the scalp and forehead. Occasionally loosening hairstyles, using gentler hair-holding methods, or alternating hairstyles reduces friction acne. Phone contact with your face transfers bacteria and causes friction acne on the jawline and cheek. Using earbuds or speakerphone when possible, cleaning your phone screen regularly, and taking breaks from phone use reduce this contact-related acne. For occupational friction acne, workers in certain industries, workplace modifications and protective equipment prevent acne. Ensuring clean, breathable protective equipment and maintaining good hygiene at work helps control occupational friction acne. Acne mechanica is often preventable through simple environmental modifications. Unlike acne requiring medications, friction acne responds to preventing the friction. This makes acne mechanica particularly frustrating when it occurs, since prevention is often simpler than treatment. Guide 54. Drug-induced acne and medication side effects. Certain medications trigger or worsen acne as a side effect. Recognizing drug-induced acne allows you to work with prescribers to modify medications or manage acne while necessary medications are continued. Corticosteroids commonly trigger acne or worsen existing acne. Systemic corticosteroids, oral, are more likely to cause acne than topical steroids, though topical steroids applied to face can also trigger acne. Patients on chronic systemic corticosteroids often experience significant acne requiring aggressive treatment. If corticosteroids are necessary, combining them with acne treatment is often required. Lithium, used for bipolar disorder treatment, causes acne in many patients. The mechanism involves effects on follicular epithelium and sebaceous gland function. Acne from lithium is sometimes severe. Working with your psychiatrist on whether alternative mood stabilizers are possible, or combining lithium with aggressive acne treatment, might be necessary. Anabolic steroids cause severe acne in nearly everyone using them. Anabolic steroid use for performance enhancement causes acne that often requires isotretinoin for management. The acne is typically severe, widespread, and on the trunk as well as face. Hormonal contraceptives can either improve or worsen acne depending on the specific formulation. Progestins with androgenic properties, like levonorgestrel or norgestrol, might worsen acne, while progestins with minimal androgenic activity, like norgestimate or drospirenone, often improve acne. If birth control is worsening acne, switching to a formulation with less androgenic progestin often helps. Anti-seizure medications sometimes worsen acne through various mechanisms. Working with your neurologist if seizure medications are worsening acne might identify alternatives or necessitate aggressive acne management. Vitamin B12 supplementation can paradoxically worsen acne in some individuals through unknown mechanisms. If you take B12 supplements and notice acne worsening, discontinuing B12 might help. The menstrual cycle consists of phases with distinct hormonal profiles affecting acne. The menstrual phase, days 1 to 5, involves shedding of uterine lining with declining hormone levels. Many women experience least acne during this phase as hormones are low. The follicular phase, days 6 to 14, involves increasing estrogen as follicles develop. Estrogen rise typically improves skin as estrogen has protective effects. Many women notice clearest skin during this phase. Ovulation, day 14, involves hormonal surge of LH and FSH. Some women experience minor acne worsening around ovulation. The luteal phase, days 15 to 28, involves rising progesterone and maintained estrogen. This phase often brings worsening acne in hormone-sensitive women due to progesterone effects and androgen to estrogen ratio changes. Tracking your acne patterns against your menstrual cycle for 2 to 3 months reveals your personal pattern. Many women find breakouts clustered in the luteal phase, particularly the 5 to 7 days before menstruation. However, individual patterns vary significantly. Some women have no cyclical acne pattern, while others have severe luteal phase breakouts. Once you identify your cyclical pattern, strategic treatment timing can optimize results. If you break out mainly in the luteal phase, intensifying acne treatment frequency during this phase can prevent significant breakouts. For example, if you normally use salicylic acid 2 to 3 times weekly, you might increase to daily use during your high-risk luteal phase. This temporary intensification often prevents the severe breakouts that would otherwise occur. Planning professional treatments around your cycle optimizes results. Having a chemical peel or professional facial during your clear follicular phase when your skin is less inflamed and more resilient provides better results than during your breakout-prone luteal phase. Hormonal contraceptives can help by suppressing ovulation and stabilizing hormone levels. Many women find that switching to birth control pills with continuous hormone dosing, tricyclic or extended cycle pills that reduce or eliminate placebo weeks, significantly reduces cyclical acne by preventing the hormonal fluctuations driving breakouts. Spironolactone, antiandrogen, helps some women with cyclical acne by blocking androgen effects. However, effects are more modest for pure cyclical acne than for chronic hormonal acne. Dietary modifications might help cyclical acne through hormone metabolism. Some evidence suggests that supporting liver health through adequate nutrients supports estrogen metabolism. Consuming adequate B vitamins, magnesium, and fiber supports hormone metabolism. PMS supplements containing ingredients like calcium, magnesium, and vitamin B6 might help with luteal phase acne through their effects on hormone metabolism and inflammation. Some women find these supplements modestly helpful. Stress during the luteal phase exacerbates acne in many women. The luteal phase naturally involves slightly increased anxiety and mood sensitivity. Implementing additional stress management during this phase, extra exercise, meditation, or relaxation practices, can reduce acne by controlling stress hormonal interactions. Sleep quality often decreases in the luteal phase due to progesterone effects. Prioritizing sleep during this phase through good sleep hygiene, potentially with earlier bedtimes, supports skin health. Understanding your cyclical acne pattern allows realistic expectations and strategic planning. Rather than being frustrated by predictable breakouts, you can anticipate them and proactively manage them. This empowerment often improves both skin outcomes and psychological well-being around acne. Guide 52, Acne Cosmetica, Product-Induced Acne and Ingredient Avoidance. Acne cosmetica specifically refers to acne triggered or worsened by cosmetic products. Understanding this condition and identifying problematic ingredients prevents wasted time and money on ineffective acne treatments when the actual problem is product-induced acne. Acne cosmetica differs from typical acne in that stopping the offending product often resolves it completely, whereas typical acne persists despite good skin care. This distinction is diagnostically important. If your acne improves dramatically after discontinuing a specific product, acne cosmetica was likely the cause. Common culprits in acne cosmetica include foundations, particularly heavy, silicone-based ones, primers, concealer, powders, sunscreen, and heavy moisturizers. These products can clog pores through their occlusive nature or irritating ingredients. Specific ingredients commonly triggering acne cosmetica include dimethicone. About acne biology helps reduce stigma. Advocacy for acne as legitimate medical concern, not purely cosmetic, helps ensure insurance coverage and professional attention. Acne affects mental health, self-esteem, and quality of life. It's not just appearance. Supporting those with acne through listening, normalizing their experience, and avoiding acne stigmatizing statements helps. Telling someone, just wash your face, or everyone gets acne, get over it, minimizes their legitimate struggles. Pushing for better acne education in schools helps teenagers understand acne and proper treatment earlier. Supporting dermatology access for all people regardless of income helps ensure everyone can access appropriate care. Advocating for inclusive acne research including diverse skin types ensures treatments developed work for everyone. Guide 80, Acne and the Senses, Smell, Touch, and Sensory Aspects of Skin Care. Beyond visual appearance, acne and skin care involve other senses affecting experience and compliance. Smell of skin care products affects whether people enjoy using them. Pleasant-smelling products increase compliance due to positive association. Some people prefer fragrance-free products to avoid irritation or strong smells. Touch sensations affect compliance. People enjoy using products that feel good on skin. Smooth-absorbing serums feel better than sticky formulations. This affects long-term routine adherence. Texture of products affects experience. Lightweight, smooth textures feel pleasant. Heavy, thick products feel uncomfortable, affecting compliance. Taste concerns arise if people accidentally get acne products in mouth, those should be avoided. Topical products shouldn't taste good, discouraging accidental ingestion. Sensory sensitivities, common in autism, sensory processing disorders, might affect product tolerability. Lightweight, minimally fragrant, smooth-textured products work better for sensory-sensitive individuals. Enjoyable sensory experience with skin care products increases likelihood of long-term compliance. Choosing products you enjoy using, good smell, nice texture, pleasant feel, supports routine adherence. Guide 81, Acne Recovery and Psychological Healing Post-Treatment. After achieving clear skin, psychological healing, moving past acne-related trauma, anxiety, or self-image damage, matters as much as physical healing. Cognitive reframing of acne experience recognizes acne as surmounted challenge rather than permanent identity. I had acne and overcame it differs from I am acne-prone in psychological impact. Rebuilding self-esteem after acne involves recognizing beauty and worth beyond skin appearance. Therapy or self-help work might support this. Managing residual anxiety about future acne recurrence is important. Some anxiety is adaptive, maintaining treatment compliance, but excessive worry isn't. Balance maintaining treatment with accepting that occasional breakouts don't mean failure. Celebrating clear skin and the journey to achieve it acknowledges the effort and success. This positive reinforcement supports continued treatment compliance. Relationships and social anxiety that develop during severe acne might persist even after clear skin. Gradual re-engagement in avoided activities supports recovery. Professional mental health support helps process acne-related psychological impact if significant trauma occurred. Guide 82, Acne and Climate Change, How Environmental Factors May Shift Acne Patterns. As climate changes, acne patterns and triggers might shift. Understanding climate-acne relationships helps anticipate these changes. Increasing temperatures in many regions mean more heat-driven acne. Sweat production increases with heat, increasing occlusion-related acne. Climate change's warming trend might increase acne prevalence. Increased humidity in some regions promotes bacterial growth and acne. Drier climates in other regions increase barrier compromise, contributing to acne. Increased air pollution from climate change effects worsens acne through oxidative stress and particle occlusion. Seasonal shifts might change acne seasonality patterns as climate changes. Increased stress from climate-related anxiety might affect acne through stress hormone pathways. Water quality changes from climate change might affect acne through different water exposure. While current climate change effects on acne are not yet clearly documented, these theoretical relationships suggest acne patterns might shift with climate. Being adaptable in acne management as environmental factors change is prudent. Guide 83, Acne in the Digital Age, Social Media, Online Communities, and Misinformation. Social media and online communities have transformed acne experience. Understanding digital age acne realities helps navigate benefits and pitfalls. Social media's focus on flawless appearance increases appearance anxiety and acne-related distress for some. Comparing yourself to filtered, edited images causes unrealistic expectations and self-esteem damage. Curated social media images where people show only their clearest skin days or use heavy filtering distort reality. Recognizing that everyone has imperfect skin days helps maintain perspective. Online acne communities provide support, shared experiences, and practical advice. These communities normalize acne and reduce isolation. Misinformation about acne spreads rapidly online. Evaluating source credibility and distinguishing evidence-based information from marketing or myth is important. Online acne forums sometimes feature unverified treatment claims. Being skeptical of anecdotal stories and seeking professional guidance for unusual claims protects you. Telemedicine dermatology accessed online expands access to professional care, beneficial for those without nearby specialists. Online skin analysis apps using AI might provide useful guidance but shouldn't replace professional assessment. Limiting social media exposure, particularly comparing images, supports mental health during acne treatment. Guide 84, Acne Treatment in Resource-Limited Settings. Many people globally lack access to standard acne treatments. Understanding available low-cost options and treatment adaptations helps those with limited resources. Over-the-counter benzoyl peroxide and salicylic acid are often affordable and available globally, even in resource-limited settings. These should be first-line treatments where available. Local botanical treatments, tea tree oil, neem oil, honey, used traditionally sometimes have evidence supporting their use. These are often affordable and locally available. Oral antibiotics, generic doxycycline, tetracycline, are often inexpensive in resource-limited settings, making oral antibiotic treatment accessible. Isotretinoin might be unavailable in many countries due to cost or regulatory restrictions, limiting treatment for severe acne without this option. Professional dermatology care might be unavailable or prohibitively expensive. Training non-specialist healthcare providers in basic acne treatment helps extend care availability. Apply sunscreen after benzoyl peroxide and wait a few minutes before reapplying other products. Generally, sunscreen should be your final skincare step before makeup. If you develop a sunburn despite sunscreen use, cool compresses, hydration, and soothing products like aloe vera help. Avoid further sun exposure until healed. Severe sunburns are dangerous and should be treated seriously. However, if you're using appropriate sunscreen correctly and minimizing peak sun exposure, severe sunburns should be rare. Guide 12. Treating post-inflammatory hyperpigmentation and acne scarring. After acne heals, two primary complications can persist: post-inflammatory hyperpigmentation, dark marks, and physical scarring. Understanding these conditions and the various treatment approaches available is essential for achieving truly clear skin, not just clear of active acne but also free from acne's lasting marks. Post-inflammatory hyperpigmentation, PIH, appears as flat, dark patches or spots where acne was previously present. These marks result from inflammation triggering excess melanin production in healing skin. PIH is particularly common in individuals with darker skin tones and in areas that received more inflammation or trauma. Unlike active acne, PIH doesn't involve bacteria or require acne-specific treatments. It requires treatments targeting melanin and pigmentation. Understanding PIH timeline is important for realistic expectations. Most PIH gradually fades naturally over 6 to 12 months with consistent sun protection, even without treatment. However, this timeline can feel unacceptably long, motivating people to pursue active treatments. The good news is that numerous treatments significantly accelerate PIH fading. Sunscreen is the foundational PIH treatment. UV exposure directly darkens hyperpigmentation, extending the timeline for natural fading. Using SPF 30+ daily and avoiding sun exposure accelerates PIH resolution dramatically. Some PIH that might take 12 months to fade with poor sun protection might fade within 3 to 4 months with strict sun protection. Vitamin C serums brighten hyperpigmentation and even skin tone. L-ascorbic acid at 15 to 20% concentration is most effective, though magnesium ascorbyl phosphate and other stabilized forms also work. Apply vitamin C serum daily in the morning before sunscreen. Results typically appear after 4 to 8 weeks of consistent use. Vitamin C also provides antioxidant protection and stimulates collagen production as a bonus benefit. Niacinamide reduces post-inflammatory redness and even skin tone. At 4 to 5% concentration in moisturizers or serums, applied daily, niacinamide shows improvements in PIH within 4 to 8 weeks. Niacinamide is gentle, suitable for even very sensitive skin, and works well in combination with other treatments. Azelaic acid is particularly effective for PIH. At 15 to 20% concentration, applied twice daily, azelaic acid reduces melanin production and even skin tone. Prescription azelaic acid, Azalex, Phenacea, is more potent than over-the-counter versions. Many dermatologists recommend azelaic acid specifically for PIH management. Results typically appear within 4 to Citric acid is generally well tolerated but can cause mild irritation in some individuals. Hydroquinone is a prescription bleaching agent highly effective for hyperpigmentation. It directly inhibits melanin production. Prescription hydroquinone typically ranges from 2 to 4% strength, applied twice daily to affected areas. Results appear within 4 to 12 weeks. However, hydroquinone should not be used continuously for more than 3 to 4 months without medical supervision, as extended use can cause paradoxical darkening or an uncommon condition called achronosis. Hydroquinone is not suitable for everyone and requires dermatologist prescription and monitoring. Chemical peels accelerate PIH resolution. Superficial peels with glycolic acid or salicylic acid remove pigmented surface skin, revealing lighter skin underneath. Monthly superficial peels combined with daily topical treatments significantly accelerate PIH fading. Medium-depth peels provide more dramatic but riskier results and are typically only performed for severe PIH. Laser treatments effectively target hyperpigmentation. Q-switched lasers are specifically designed to break up melanin pigment, with different wavelengths targeting different pigment depths. These treatments provide results in 4 to 6 sessions, sometimes fewer for responsive PIH. However, laser treatment is expensive and carries risks of complications in darker skin types. IPL, intense pulsed light, therapy also addresses pigmentation effectively. Microdermabrasion physically removes pigmented surface skin through mechanical abrasion. Performed monthly, combined with topical treatments, it accelerates PIH resolution. However, it's less powerful than laser treatments and typically requires more sessions. Combination approaches yield best results. Most dermatologists recommend combining daily topical treatments, vitamin C, azelaic acid, or hydroquinone, with monthly professional treatments, chemical peels or laser. This dual approach treats PIH from multiple angles, achieving faster, more complete resolution. Acne scarring is a more permanent complication than PIH. Scarring results from significant inflammation destroying collagen, resulting in physical indentations or elevation of the skin. There are 3 main types of acne scars: ice pick scars, deep, narrow indentations; boxcar scars, wider, flat-bottomed indentations; and rolling scars, wave-like depressions. Prevention is the most effective scar treatment. Avoiding picking, squeezing, or extracting pimples prevents scarring. Treating acne aggressively prevents deep inflammation that causes scarring. Taking acne seriously and treating it promptly prevents severe scarring. For existing scars, multiple treatment options exist, though complete elimination is often impossible. The goal is significant improvement. Topical treatments are largely ineffective for true scarring, as scarring involves structural damage that topical products can't reverse. However, improving overall skin texture and treating associated hyperpigmentation can make scars less noticeable. Subcision is a minor surgical procedure where a needle is inserted under the scar, breaking the fibrous tissue causing the depression. This allows collagen to regenerate and fill the scar. Subcision works best for rolling scars and tethered scars. Results appear gradually over 6 to 12 months as new collagen forms. Laser resurfacing removes thin layers of skin, smoothing scars. Fractional laser resurfacing is less aggressive than full resurfacing and requires less downtime. Multiple individuals receiving hormone therapy often experience acne changes related to hormonal transition. Understanding these changes helps manage acne during transition. Testosterone-based hormone therapy, for transmasculine individuals, typically worsens acne initially due to increased androgens. Acne often develops or significantly worsens during the first 1 to 2 years of testosterone therapy. This is particularly challenging for individuals already prone to acne. Aggressive acne prevention and treatment during testosterone initiation is important. Some individuals benefit from starting acne treatment prophylactically before or as testosterone therapy begins. Estrogen-based hormone therapy, for transfeminine individuals, typically improves acne over time as androgens are suppressed. Many transfeminine individuals experience significant acne improvement within several months to a year of estrogen therapy. This improvement can be dramatic and psychologically significant. Spironolactone, commonly used alongside estrogen therapy for anti-androgen effects, has acne beneficial effects. The combination of spironolactone plus estrogen provides maximal acne improvement in transfeminine individuals. Timeline for hormone therapy acne effects is important to understand. Acne worsening from testosterone therapy might persist 1 to 2 years before stabilizing or improving. Setting realistic expectations prevents discouragement during this period. Psychological impact of acne during transition deserves acknowledgement. Acne during transition, when someone is often already managing significant life changes and body image adjustments, can cause additional distress. Aggressive acne management acknowledges this psychological weight. Working with dermatologists and endocrinologists familiar with transgender health improves care. Some clinicians are specifically experienced in managing acne in hormone therapy contexts. Iodine-containing supplements or medications can trigger acne. High-dose iodine supplementation is associated with acne worsening. This is one reason avoiding excessive iodine supplementation unless specifically indicated is prudent. Phenytoin, anti-seizure medication, and other older anti-seizure drugs can trigger acne or gingival hyperplasia, gum overgrowth. If these medications are necessary, managing side effects is required. When drug-induced acne is suspected, first confirm with your prescribing healthcare provider that the medication is likely the culprit. Assess whether alternative medications without acne side effects exist. If alternatives don't exist, combine the medication with aggressive acne treatment. Don't discontinue necessary medications without medical guidance even if acne worsens. Guide 55, Nutritional Deficiencies and Acne, Zinc, Vitamin D, Selenium, and beyond. Certain nutritional deficiencies correlate with worse acne. Understanding which deficiencies affect acne allows you to assess your nutritional status and supplement if needed. Zinc deficiency is well established as correlating with worse acne. Zinc supports immune function, wound healing, and inflammation regulation, all relevant to acne. People with zinc deficiency have notably worse acne. Supplementing adequate zinc, 30 mg daily, often improves acne significantly if deficiency exists. However, supplementing when not deficient provides minimal additional benefit. Identifying zinc deficiency involves blood testing. However, zinc blood levels don't always accurately reflect total body zinc stores, making interpretation complex. If you suspect zinc deficiency, discussing blood zinc testing with your healthcare provider is reasonable. Vitamin D deficiency correlates with worse acne and increased inflammation. Vitamin D supports immune function and has anti-inflammatory effects. Many people, particularly those in northern climates or those who avoid sun exposure, have vitamin D deficiency. Supplementing vitamin D at 1000 to 400 IU daily improves acne in some individuals, particularly those with low baseline levels. Testing vitamin D status can help identify deficiency. Selenium deficiency affects immune function and skin health. Adequate selenium, 55 to 200 micrograms daily, supports skin health. However, acne-specific benefits of selenium supplementation aren't definitively established. Iron deficiency, particularly in menstruating women, can affect overall skin health and healing. Severe iron deficiency anemia causes various health problems including poor wound healing and immune dysfunction. However, iron supplementation for non-deficient people doesn't improve acne. Vitamin A, retinol, deficiency causes follicular hyperkeratinization and immune dysfunction contributing to acne. However, toxicity from excess vitamin A is also problematic. Getting adequate vitamin A through diet, liver, sweet potato, leafy greens, is ideal. Supplementing vitamin A is only necessary if deficient. B vitamins, particularly B5, pantothenic acid, are promoted for acne at very high doses, 10 plus grams daily. However, evidence is weak and high-dose B5 causes diarrhea frequently. Normal B vitamin intake through diet or multivitamin supplementation supports general health without special acne benefits. Omega-3 fatty acid deficiency promotes systemic inflammation worsening acne. Getting adequate omega-3s, 1 to 2 grams EPA plus DHA daily from fish or supplements, supports skin health through inflammation reduction. Identifying nutritional deficiencies, blood testing can assess status for most nutrients. Dietary assessment helps identify if diet provides adequate nutrients, considering supplementation if deficiencies are identified. However, supplementing without deficiency rarely provides additional benefit. Getting nutrients through food when possible is preferable to supplementation. Guide 56, Occupational Acne Syndromes, Tar acne, Oil acne, and Chemical exposure. Workers in certain occupations experience acne specifically from occupational chemical exposures. Understanding occupational acne helps you implement prevention strategies and pursue appropriate treatment. Tar acne develops in workers exposed to coal tar, crude oil, and petroleum products. Mechanics, road workers, and petroleum industry workers are susceptible. Tar acne results from follicular occlusion and irritation from these substances. Appearance is often on exposed areas, hands, face, neck, forearms. Oil acne develops in workers exposed to mineral oils and cutting fluids in metalworking, automotive work, and similar occupations. These oils are comedogenic and occlusive, clogging pores and promoting acne. Oil acne is often quite severe if exposure is chronic. Guide 63, Acne in Patients with Liver Disease and Metabolic Disorders. Liver disease and metabolic disorders can affect acne through various mechanisms. Managing acne in these populations requires special consideration. Liver disease affects hormone metabolism, potentially worsening hormonal acne. Patients with cirrhosis or chronic hepatitis often have worsened acne due to impaired estrogen metabolism and altered hormone regulation. Metabolic syndrome, combination of obesity, insulin resistance, hypertension, and dyslipidemia, correlates with worse acne. For example, establish stable benzoyl peroxide use for 4 weeks before adding salicylic acid to your routine. Use complementary treatments on different parts of your routine when possible. For example, use salicylic acid cleanser in the morning, brief contact, mild treatment, and benzoyl peroxide leave on at night, extended contact, potentially more irritating. This separation minimizes cumulative irritation. Monitor for excessive irritation. If combining treatments causes significant redness, dryness, peeling, or sensitivity beyond what either treatment alone causes, reduce frequency of one or both treatments. You can use both treatments but at lower frequencies, for example, benzoyl peroxide once daily instead of twice daily, or salicylic acid 2 to 3 times weekly instead of daily. The sandwich method reduces irritation when combining treatments. Apply your first treatment, perhaps benzoyl peroxide, wait 20 minutes, apply moisturizer, then apply your second treatment, perhaps retinoid. This dilutes treatment somewhat and reduces irritation while maintaining efficacy. Some combinations should be avoided or approached cautiously. Vitamin C and benzoyl peroxide together can reduce vitamin C effectiveness, so apply these at different times. Retinoids and strong chemical exfoliants used on the same evening can cause excessive irritation. Separate these if combining. Benzoyl peroxide with niacinamide is generally fine, though separating them, benzoyl peroxide at night, niacinamide in morning moisturizer, is easier. Assessment of combination therapy effectiveness requires patience. Most people need 8 to 12 weeks of consistent combination therapy to determine if it's working well. Acne doesn't improve overnight. Allow adequate time for evaluation. Adjusting combinations based on response is important. If one component seems essential while another isn't providing obvious benefit, you might discontinue the less beneficial component. Conversely, if you're experiencing insufficient improvement, you might increase one component's frequency or concentration, or add an additional treatment, perhaps adding retinoid to an existing benzoyl peroxide and salicylic acid combination. Professional guidance is valuable when considering combination therapy for severe acne. Your dermatologist can recommend appropriate combinations, warn about potential interactions, and guide introduction sequencing. Don't hesitate to discuss combination therapy approaches with your dermatologist. Guide 24, Understanding and Managing Fungal Acne, Malassezia folliculitis. Fungal acne, more accurately called Malassezia folliculitis or Pityrosporum folliculitis, is often misdiagnosed as bacterial acne. This condition presents similarly to acne but results from yeast overgrowth rather than bacterial infection, requiring different treatment approaches. Understanding this condition prevents prolonged ineffective treatment with standard acne medications. Malassezia is a naturally occurring yeast on human skin. In most people, it colonizes skin without causing problems. However, in some individuals, conditions favor Malassezia overgrowth, leading to follicle inflammation and fungal acne appearance. Unlike bacterial acne caused by Cutibacterium acnes, fungal acne results from yeast proliferation. Fungal acne typically appears as uniform, small pustules, often in clusters on the back, chest, and shoulders, though facial fungal acne occurs. The pustules are often quite uniform in size and appearance, less variable than typical bacterial acne. Fungal acne is often very itchy or uncomfortable, more so than typical acne. It often appears or worsens after antibiotic courses, as antibiotic elimination of competing bacteria allows malassezia to proliferate unopposed. Several factors promote malassezia overgrowth. Warm, humid environments favor yeast growth, explaining why fungal acne often worsens in summer or in humid climates. Excessive sweating creates favorable conditions. Wearing tight, non-breathable clothing traps moisture and heat, promoting yeast overgrowth. Immunosuppression or diabetes can promote yeast overgrowth. Recent antibiotic courses allow malassezia to proliferate. Oil-based products and heavy moisturizers can promote yeast growth in susceptible individuals. Diagnosing fungal acne requires suspicion. If your acne doesn't respond to standard acne treatments, doesn't respond to antibiotics, or started after antibiotics, fungal acne is possible. Your dermatologist can perform a KOH, potassium hydroxide, preparation or fungal culture to confirm malassezia, though clinical diagnosis is often sufficient. Standard bacterial acne treatments are ineffective for fungal acne because they don't address yeast. Benzoyl peroxide and salicylic acid have minimal effect on malassezia. Antibiotics don't treat yeast. Retinoids don't specifically treat yeast. Using these treatments on fungal acne can be frustrating. You follow a good acne regimen but see no improvement because the underlying cause isn't bacterial. Topical antifungals effectively treat fungal acne. Ketoconazole, available in shampoos and creams, kills malassezia. Apply 2% ketoconazole cream to affected areas daily. Many people use ketoconazole shampoo on body areas, lathering and leaving it on for 5 to 10 minutes before rinsing. Ketoconazole is gentle and suitable for frequent use. Zinc pyrithione is another topical antifungal commonly found in anti-dandruff shampoos. At 1 to 2% concentration, applied daily, it reduces malassezia and can improve fungal acne. Like ketoconazole, it's gentle and suitable for long-term use. Selenium sulfide is a strong topical antifungal traditionally used for fungal skin conditions. At 2.5% concentration, available by prescription, applied daily, selenium sulfide effectively treats fungal acne. However, some people find it irritating or have sensitivity, limiting its use in some cases. For extensive fungal acne or fungal acne resistant to topical antifungals, oral antifungals may be necessary. Fluconazole is a systemic antifungal taken orally. Typical dosing for fungal acne is 50 to 100 mg daily for 2 to 4 weeks, or alternatively, 200 mg weekly for several weeks. Oral fluconazole effectively treats extensive fungal acne and reaches areas topical antifungals cannot. However, oral antifungals can have side effects and require more medical supervision than topicals. Itraconazole is another systemic antifungal option, sometimes used as an alternative to fluconazole. Dosing and duration vary based on specific protocols and severity. Additional strategies for fungal acne management include addressing contributing factors. Wear breathable, moisture-wicking clothing. Shower promptly after sweating. Keep skin clean and dry. Use gentle, minimal skin care. Avoid heavy oils and occlusive moisturizers. Live and dry environments when possible or use a dehumidifier. These environmental modifications reduce conditions favoring yeast overgrowth. Niacinamide may provide supplementary benefit for fungal acne, as it has mild antifungal properties and reduces sebum production. Action can also cause micro tears in your skin barrier, leading to increased sensitivity and irritation. For these reasons, dermatologists typically recommend avoiding physical scrubs if you have acne. Chemical exfoliation is gentler and more effective. There are two main types of chemical exfoliants: alpha-hydroxy acids, AHAs, and beta-hydroxy acids, BHAs. AHAs, including glycolic acid and lactic acid, are water-soluble and work on the skin's surface. They're excellent for general exfoliation, improving texture, and reducing the appearance of fine lines. However, they don't penetrate into oil-filled pores effectively. BHAs, particularly salicylic acid, are oil-soluble and can penetrate into sebum-filled pores, making them ideal for acne-prone skin. Salicylic acid dissolves the sebum and dead skin cell plug within the follicle, directly preventing and treating comedones. For acne-prone skin, exfoliating 2 to 3 times weekly with salicylic acid is generally appropriate. Some people with very resilient skin can tolerate daily use, while those with sensitive skin may do better with once or twice weekly exfoliation. Begin conservatively with 2 to 3 times weekly, observing how your skin responds over 2 to 3 weeks before increasing frequency. Exfoliation products come in various formats. Exfoliating cleansers contain salicylic acid and are used during your regular cleansing routine. These are gentle and convenient for daily use. Exfoliating toners are applied after cleansing and before other treatments. They're typically stronger than cleansers and are meant to be left on the skin. Exfoliating serums and treatments are the most concentrated forms and are usually applied 2 to 3 times weekly. Exfoliating masks are meant to be applied for a specific duration, usually 10 to 15 minutes, then rinsed off. When starting exfoliation, begin with a lower concentration of salicylic acid, typically 0.5% to 1%, and gradually work up to 2% as your skin builds tolerance. Many beginners make the mistake of jumping to high concentrations, causing excessive irritation, dryness, and peeling. This leads them to conclude that exfoliation doesn't work for them when the actual problem was starting too strong. The exfoliation process requires proper technique. Apply your exfoliating product to clean, completely dry skin. Applying to damp skin increases irritation and reduces effectiveness. Use your fingertips to apply the product gently, spreading it evenly across your face, paying special attention to areas where acne is most prevalent. Some exfoliating products are meant to be left on overnight, while others are rinsed off after a specific duration. Follow product instructions carefully. During the initial exfoliation period, expect some adjustment. Your skin may experience mild redness, slight dryness, or mild peeling. This is normal and typically subsides within 1 to 2 weeks as your skin adapts. However, if you experience severe irritation, excessive peeling, or significant discomfort, reduce your exfoliation frequency or concentration. Listen to your skin, it will tell you what it needs. Never combine multiple exfoliating products on the same day, and especially avoid combining exfoliants with other strong actives like retinoids or benzoyl peroxide on the same night initially. This overexfoliation damages your skin barrier, causes excessive irritation, and can actually worsen acne. Once your skin is accustomed to each product individually, you can sometimes combine them, but do so cautiously and only if your skin tolerates it well. Some people experience purging when they begin exfoliation, where acne temporarily worsens as the exfoliant brings impurities to the skin's surface. This is generally a positive sign that the product is working, and it usually subsides within 1 to 2 weeks. However, if purging lasts longer than 2 to 3 weeks or becomes unbearable, discontinue the product and consult a dermatologist. After exfoliating, your skin barrier is compromised and needs careful management. Moisturize generously with a product suitable for your skin type. Avoid other potentially irritating ingredients like vitamin C, niacinamide in high concentrations, or peptides on exfoliation days. Stick to basic cleanse, exfoliate, and moisturize. Use sunscreen religiously, as exfoliated skin is more susceptible to UV damage. Seasonal variations affect exfoliation needs. During winter, when skin is naturally drier, you may need to reduce exfoliation frequency. During summer, when skin is oilier and more resilient, you might tolerate more frequent exfoliation. Listen to your skin and adjust accordingly. Results from regular exfoliation appear gradually. After 4 weeks of consistent exfoliation with salicylic acid, you should notice smoother texture, fewer comedones, and generally improved skin clarity. Acne lesions should appear flatter and less inflamed. However, exfoliation is most effective as part of a comprehensive acne treatment plan, not as a standalone solution. Guide 4: Salicylic Acid, the Science, Concentrations, and Complete Application Guide. Salicylic acid has been a cornerstone of acne treatment for decades, and understanding its mechanism and proper use is essential for anyone dealing with acne. Salicylic acid is a beta-hydroxy acid, BHA, meaning it's oil-soluble. This oil solubility is what makes it particularly effective for acne-prone skin. It can penetrate into oil-filled pores where other water-soluble ingredients cannot reach. Salicylic acid works through multiple mechanisms. First, it acts as a keratolytic, meaning it helps dissolve the protein bonds between dead skin cells, promoting cell shedding. Inside the follicle, it dissolves the sebum and dead skin cell mixture that forms comedone plugs. Second, it has mild antibacterial properties, helping reduce bacterial colonization within blocked pores. Third, it has anti-inflammatory effects, reducing the redness and irritation associated with acne lesions. Fourth, it can stimulate cellular turnover, promoting healthier skin overall. Salicylic acid comes in various concentrations, typically ranging from 0.5% to 2%. The concentration directly correlates with effectiveness and also with irritation potential. A 0.5% solution is very gentle, making it suitable for sensitive skin or those new to salicylic acid. A 1% solution is considered standard for most people with acne-prone skin, providing a good balance between effectiveness and tolerability. A 2% solution is the maximum recommended concentration for at-home use, offering significant exfoliating power but requiring experienced use to avoid over-irritation. Professional-grade salicylic acid can be applied at concentrations up to 20 to 30% during chemical peels, but these are only performed in clinical settings and are significantly stronger than over-the-counter products. Salicylic acid products come in numerous formats, each with advantages and disadvantages. Cleansers containing 0.5 to 2% salicylic acid are the gentlest form. You use them daily during your regular cleansing routine, and the short contact time limits irritation while still providing exfoliating benefits. Cleansers are ideal for maintaining clear skin and for beginners new to salicylic acid. Toners or liquid exfoliants contain higher concentrations and are left on the skin, providing more potent exfoliation than cleansers. These are typically applied after cleansing and before other treatments, 2 to 3 times weekly. They provide more dramatic exfoliation than cleansers but also carry more irritation risk. Serums and treatments are concentrated salicylic. Laser treatments require careful consideration for darker skin types. Many traditional lasers carry higher complication risk in darker skin, including post-inflammatory hyperpigmentation and depigmentation. Lasers specifically designed for darker skin types or lower fluence approaches are preferable. This is one area where working with dermatologists experienced in treating darker skin types is particularly important. Cultural attitudes toward acne and appearance affect treatment seeking and treatment consistency. Some cultures have strong stigma around acne, while others are more accepting. Understanding your cultural context and how it affects your response to acne helps manage psychological impact. Genetic predisposition to acne varies somewhat across ethnic backgrounds. Some populations have higher acne prevalence, though individual variation is substantial and environmental factors play large roles.
第2幕、裁きの重み。店は、上品な書で、菊と書かれた控えめな木製の看板で姿を現した、菊の花。こう、広しはその入り口の前に立っていた。蜂蜜色の木で作られた引き戸からは、高級感と特別感が静かに伝わってくる。障子越しには、朝の仕込みの音がかすかに聞こえた、まな板を叩く包丁のリズム、水が流れる音、鋼同士がぶつかる金属音。彼は到着の時間を入念に測った、午前10時47分。朝食の片付けが終わり、昼の準備に取り掛かるその狭間は、厨房が人手の必要を見極める絶妙なタイミングだ。引き戸を開ける彼の手は、わずかに震えていた。いらっしゃいませ。奥から自動的に声がかかり、慌ただしい足音が続いた。真新しい着物を着た若い女性が現れ、笑顔で迎えかけたが、コウの姿を見るとその笑みが一瞬で曇った。あ、すみません、おじさん。彼女は高齢の男性に使う砕けた呼び方でそう言った。それはコウの胸に小さな刃のように突き刺さった。お昼の営業は正午からなんです。求人の件で来ました。コウは声を乱さずに答えた。厨房スタッフの募集です。彼女の目は、擦り切れたカーディガン、年齢を感じさせる手、わずかに前かがみになった背中を素早く見回した。あ、少々お待ちください。彼女は奥へ引っ込み、コウは玄関先に配達員のように取り残された。店内は本気度を物語っていた。ヒノキの一枚板でできた長いカウンターは、すべての席が寸分の狂いもなく配置されている。カウンターの奥では厨房が輝いていた。磁気ストリップに並んだドイツ製の包丁、光を反射して小さな太陽のように輝く銅鍋。しつらえは現代的でありながら伝統への敬意を忘れていない若い世代がネオ解析と呼ぶスタイルだ。何の用だ。威厳を含んだ声が空気を切った。厨房から男が現れた。35歳くらいだろうか、白衣は刃物のようにパリッとしている。シェフボー、トックはおしゃれに傾けられ、両腕には真剣に厨房を渡り歩いてきたことを物語る火傷と傷跡が刻まれていた。これが、この店の料理長なのだろ
う。Guide 41, Microneedling RF and Advanced Microneedling Technologies for Acne Scarring. Advanced microneedling technologies combine traditional microneedling with additional energy sources or techniques for enhanced results in acne scar treatment. Understanding these advanced options helps you select appropriate professional treatments. Radiofrequency, RF, microneedling combines microneedling with radiofrequency energy delivered through the needles. As needles penetrate skin, they deliver RF energy at depth, providing enhanced collagen stimulation compared to standard microneedling. The combination approach produces more dramatic results but with more significant post-treatment appearance changes. Recovery involves 5 to 7 days of significant redness and swelling compared to 3 to 5 days for standard microneedling. Microneedling depth significantly affects results and recovery. Shallow microneedling, 0.5 mm, primarily addresses surface concerns with minimal downtime. Medium depth, 1 to 1.5 mm, addresses scarring moderately with moderate downtime. Deep microneedling, 2.0 to 2.5 mm, addresses severe scarring most effectively but with significant recovery time and complication risks. Your practitioner determines appropriate depth based on scar severity and recovery tolerance. Fractional microneedling treats portions of skin rather than entire areas, leaving some skin untouched for faster healing. This approach provides good scar improvement with reduced downtime compared to full-face treatment. Multiple sequential treatments spaced 4 to 6 weeks apart provide cumulative improvements superior to single treatments. Most scar improvement appears over 3 to 6 months following each treatment as collagen remodels. Treatment plans typically involve 3 to 6 sessions. Post-treatment care optimizes results. Aggressive sun protection, SPF 50+, daily application, reapplication every 2 hours outdoors, is crucial during recovery. Healing serums with growth factors support skin recovery. Avoiding active ingredients during recovery week allows skin barrier to heal. Resuming actives cautiously after recovery supports ongoing improvement. Combining microneedling with other scar treatments, subcision, fillers, laser, often provide superior results to any single approach. Your dermatologist can recommend appropriate combinations for your specific scars. Guide 42, Emerging Probiotic and Postbiotic Skincare Research. Probiotic and postbiotic skincare represents an emerging frontier addressing acne through microbiome support. Understanding this emerging field helps you evaluate whether these approaches might benefit your skin. Topical probiotics contain live bacteria applied to skin. While the colonization potential of topical probiotics on skin is limited, skin has established microbiota that resists colonization. These products may provide benefit through bacterial metabolites and immune stimulation. Some evidence suggests certain probiotic strains reduce acne severity modestly. Postbiotics are metabolites produced by bacterial fermentation, essentially the waste products of probiotics with bioactive properties. Postbiotic serums contain these metabolites without live bacteria, avoiding stability and colonization concerns of live probiotics. Postbiotics show promise for reducing inflammation and supporting skin barrier. Fermented ingredients, products where plant ingredients have been fermented by beneficial bacteria, provide postbiotic-like benefits. These fermented products often have enhanced stability and penetration compared to non-fermented counterparts. Evidence for probiotics and postbiotics remains emerging rather than definitively proven. While some studies show modest benefits, high-quality large studies are limited. Probiotic and postbiotic skincare can supplement other treatments but shouldn't replace proven acne therapies. Quality matters significantly for probiotic products. High-quality products with documented effective strains are preferable to low-quality options. However, quality doesn't guarantee personal benefit. Guide 43, artificial intelligence and personalized acne treatment. Artificial intelligence is beginning to transform dermatology through skin analysis and personalized treatment recommendations. Understanding these tools helps you evaluate whether AI-guided approaches might supplement your dermatology care. Reframing skincare as health maintenance rather than beauty obligation increases motivation for some people. Viewing skincare as caring for your body's largest organ similar to exercising or eating well helps maintain consistency even when acne is controlled. Celebrating milestones and achievements maintains motivation. Reaching certain milestones, 8 weeks of consistent routine, first month of clear skin. Most retinization symptoms peak at weeks 2 to 4 and resolve by weeks 6 to 8. However, expecting this phase mentally prepares you to persist through it rather than discontinuing retinoids prematurely. Managing retinization involves strategic moisturizing. The sandwich method, applying retinoid, waiting 20 minutes, applying moisturizer, waiting a few minutes, then applying another thin moisturizer layer, significantly reduces retinization severity while maintaining efficacy. As your skin adapts over 8 to 12 weeks, you can gradually stop using the sandwich method, eventually applying retinoid directly to dry skin. Buffering retinoid strength temporarily by mixing it with moisturizer reduces irritation without substantially compromising effectiveness. Some experienced retinoid users eventually apply retinoids directly to skin for maximum strength, while others continue using the sandwich method indefinitely because it works well for them. There's no wrong approach. Use whatever maintains your skin health while providing desired results. Niacinamide effectively reduces retinoid irritation. Using niacinamide serum in the morning and retinoid at night doesn't provide the irritation-reducing effect. However, some evidence suggests applying niacinamide before retinoid, allowing niacinamide to dry, then applying retinoid on top, might reduce irritation slightly. This is controversial, with some experts suggesting niacinamide interferes with retinoid efficacy, while others dispute this. For most people, using niacinamide and retinoid at different times is the safest approach. Ceramide-rich moisturizers particularly well support retinoid use by maintaining barrier health during treatment. Using moisturizers specifically formulated with ceramides, cholesterol, and fatty acids alongside retinoids helps prevent excessive dryness and irritation. Combining retinoids with other actives requires careful sequencing. Retinoids should not be combined with AHAs, BHAs, or vitamin C initially. After 12+ weeks of stable retinoid use, you might carefully introduce another active on different nights. Many experienced users successfully use retinoid nightly and salicylic acid or benzoyl peroxide on alternate mornings, but this requires well-adapted skin. Retinoid stability matters for effectiveness. Retinol degrades with light and air exposure. Products in opaque, airtight packaging remain stable longer than those in clear or non-airtight packaging. Storing retinoid products in cool, dark places preserves stability. Retinoids become less effective as they degrade, so proper storage extends product effectiveness and lifespan. Retinoid pulse dosing, using retinoids intensively for periods, then taking breaks, is a strategy some dermatologists recommend. The theory is that continuous daily use might cause adaptation, reduced effectiveness, while pulsing maintains efficacy. However, most retinoid experts recommend continuous daily use for consistent results. Occasional breaks for barrier repair are reasonable, but pulsing isn't necessary for maintaining retinoid effectiveness long term. Combination retinoid protocols use multiple retinoids simultaneously for enhanced benefit. For example, using low-concentration tretinoin at night combined with retinol in the morning. However, this advanced approach requires very well-adapted skin and should only be attempted under professional guidance. It increases irritation risk and isn't necessary for most people. Pregnancy and retinoid use requires special consideration. Retinoids are teratogenic and should not be used during pregnancy. Women of childbearing potential using isotretinoin must use reliable contraception. Tretinoin used during pregnancy is controversial. Some studies suggest it's safe at prescribed topical doses where systemic absorption is minimal, while others recommend avoiding it. Discuss retinoid use with your obstetrician if planning pregnancy or pregnant. Adapting retinoid use seasonally may be beneficial. In winter, when skin is naturally drier, you might reduce retinoid frequency or concentration, or increase moisturizing support. In summer, if your skin tolerates it, you might increase retinoid frequency for more aggressive treatment. Signs of excessive retinoid use include severe dryness, persistent redness beyond the initial retinization phase, barrier compromise, or contact dermatitis. If you experience these, reduce frequency or concentration. There's no badge of honor for using the highest concentration or frequency if your skin is suffering. Optimal retinoid use maintains healthy skin while providing acne and anti-aging benefits. Guide 34. Sleep Quality and Acne, Mechanisms, Optimization Strategies, and Sleep-Specific Skincare. Sleep profoundly affects acne through multiple physiological mechanisms. Understanding sleep acne connections and implementing sleep optimization and sleep-specific skincare significantly improves acne. During sleep, your body undergoes restorative processes crucial for skin health. Growth hormone peaks during deep sleep, supporting skin repair and collagen production. Cortisol, the stress hormone, declines during sleep, reducing inflammation. Immune function is enhanced during sleep, supporting the body's ability to fight infection-causing bacteria. Cellular turnover occurs during sleep, with dead skin cells being replaced by new ones. All these processes directly support clear, healthy skin. Poor sleep disrupts these beneficial processes. Insufficient sleep, less than 7 hours nightly, increases cortisol, promotes inflammation, impairs immune function, and disrupts cellular turnover. The result is worsened acne within days of poor sleep. Many people notice acne worsening after only 1 or 2 nights of insufficient sleep, demonstrating sleep's direct acne effects. Sleep timing matters as much as sleep duration. Your body has a circadian rhythm, an internal clock regulating hormone release and physiological processes. Disrupted circadian rhythm, from shift work, irregular sleep schedules, or jet lag, worsens acne even if total sleep duration is adequate. Maintaining consistent sleep schedules, going to bed and waking up at the same times daily, optimizes circadian rhythm function and supports skin health. Sleep quality matters beyond duration. Fragmented sleep with frequent awakenings, even if total sleep time is adequate, compromises skin health. Poor sleep quality is associated with worse acne. Improving sleep quality requires addressing sleep disruptions through sleep hygiene optimization. Sleep position might influence acne through mechanical and bacterial mechanisms. Sleeping on your back avoids facial contact with pillows and your hands, reducing friction, acne, and bacterial transfer to your face. Sleeping on your side or stomach involves prolonged face pillow contact, increasing friction and bacterial exposure. However, changing sleep position is difficult if you're not accustomed to it. If you naturally sleep on your side or stomach, prioritize other acne management strategies rather than forcing an uncomfortable sleep position change. Pillowcase cleanliness significantly impacts acne. Dirty pillowcases accumulate bacteria, oil, and dead skin cells, all of which transfer to your face during sleep. Some dermatologists recommend changing pillowcases every 2 to 3 days for acne-prone individuals. Alternatively, sleeping on a clean towel over your pillowcase and changing the towel daily is effective and economical. Some people with severe acne benefit from silk or satin pillowcases, which create less friction and accumulate less bacteria than cotton. Bedroom temperature affects sleep quality. Warmer rooms increase perspiration, creating a moist environment promoting bacterial growth and acne. A cooler bedroom, around 65 to 68 degrees Fahrenheit or 18 to 20 degrees Celsius, supports better sleep and reduces nighttime sweating. If your bedroom is too warm, using a fan or air conditioning improves both sleep quality and acne through multiple mechanisms. Humidity in the bedroom affects skin and sleep. Excessively dry air, from heating systems or dry climate, irritates skin and disrupts sleep. Excessively humid air promotes bacterial growth and acne. Moderate humidity, 30 to 50%, is optimal. Using a humidifier in dry climates or a dehumidifier in humid climates optimizes sleep environment and supports skin health. Light exposure, particularly blue light from screens, suppresses melatonin production, disrupting sleep timing and quality. Using devices before bed worsens sleep through this mechanism. Stopping screen use 30 to 60 minutes before bed improves sleep quality. Using blue light filters on devices if evening screen use is unavoidable provides some protection. Getting your acne type right prevents wasting time on ineffective treatments. Step 2. Assess your skin type and sensitivities. Is your skin oily, dry, combination, or balanced? Very sensitive or robust? Do you have history of allergic reactions? Do you have rosacea or other reactive conditions? This information determines which products and concentrations your skin tolerates. Sensitive skin requires gentler products, lower active ingredient concentrations, and slower introduction of new treatments. Oily skin tolerates stronger treatments and higher concentrations. Dry skin requires careful moisturizing even while using drying treatments. Step 3. Evaluate contributing factors. What worsens your acne? Stress, hormonal cycles, certain foods, sleep deprivation, specific products, environmental factors. Identifying contributing factors allows you to address root causes alongside medical treatment. If stress worsens acne, stress management becomes part of your treatment. If hormonal cycles worsen acne, tracking cycles and timing treatment adjustments helps. Step 4. Set realistic timelines and goals. Most acne improves over 8 to 12 weeks of consistent treatment. Severe acne might take 4 to 6 months or longer. Scars fade over 6 to 12 months with appropriate treatment. Setting realistic expectations prevents discouragement from expecting overnight results. Your goal might be clear skin or manageable acne with occasional breakouts, depending on your acne severity. Step 5. Design your morning routine. Start with a gentle cleanser appropriate for your skin type, used with lukewarm water. Follow with optional essences or hydrating toners if desired. Apply any morning actives, perhaps vitamin C serum for antioxidant protection. Apply your morning moisturizer. Finish with SPF 30+ sunscreen. This entire routine should take 5 to 10 minutes. Keep it simple so it's sustainable. Step 6. Design your evening routine. Start with makeup removal if applicable, oil-based cleanser or micellar water. Follow with your evening cleanser. Apply any evening hydrating toners or essences. Apply your primary acne treatment, perhaps salicylic acid or benzoyl peroxide, starting at low frequency, typically 2 to 3 times weekly. After allowing this to dry, wait 10 to 20 minutes, apply your moisturizer. If using retinoids, apply them now, after at least 2 to 3 weeks of tolerance building. Optional, apply occlusive oil or balm as final step if your skin is dry. Step 7. Plan your treatment introduction sequence. Never introduce multiple new treatments simultaneously. Introduce your first active treatment, perhaps salicylic acid, use it 2 to 3 times weekly for 3 to 4 weeks, then reassess. If tolerating well and seeing some improvement, after 4 weeks consider introducing a second active, perhaps benzoyl peroxide on different days/times. Build your routine gradually over 8 to 12 weeks. This patience is rewarded with better long-term results than aggressive starting. Step 8. Plan adjustments based on response. After 8 to 12 weeks of consistent treatment, reassess. Is acne improving? Are side effects manageable? Do you need to increase treatment intensity? Based on your assessment, you might increase frequency of treatments, increase concentration, add another treatment, or make other adjustments. However, only adjust one variable at a time so you know what caused any changes. Step 9. Incorporate lifestyle factors. Alongside your skincare routine, implement dietary changes, reduce sugar, increase antioxidants, perhaps reduce dairy. Prioritize sleep, 7 to 9 hours nightly. Implement stress management, meditation, exercise, or your preferred method. These factors take 4 to 8 weeks to show skin effects but provide significant benefits. Step 10. Plan professional treatments if appropriate. If after 12 weeks of diligent home care your acne hasn't adequately improved, consider professional treatments like chemical peels, laser, or blue light therapy. Monthly professional treatments combined with home care often produce better results than home care alone for moderate to severe acne. Step 11. Plan long-term maintenance. Once your acne clears, identify which treatments were essential for your success and continue them at maintenance levels. Your maintenance routine might be simpler than your treatment routine, perhaps just retinoid at night and sunscreen during the day, but it should continue indefinitely to prevent acne recurrence. Step 12. Build flexibility for adjustments. Your perfect routine isn't static. Seasonal changes, life stress changes, hormonal cycles, and other factors might necessitate routine adjustments. Have a plan for intensifying treatment during high-risk times, increased stress, menstrual cycle high-risk phase. Be willing to adjust your routine based on your skin's response rather than rigidly sticking to something not working. A sample personalized routine for moderate inflammatory acne might look like: morning, gentle cleanser niacinamide serum, optional, lightweight moisturizer SPF 30+ sunscreen. Evening, makeup removal if applicable, gentle cleanser hydrating toner/essence, optional, benzoyl peroxide 2.5%, 3 to 4 times weekly initially, moisturizer optional, retinoid, starting 2 to 3 times weekly after tolerance built. Lifestyle: 7 to 9 hours sleep, 30 minutes exercise 5 times weekly, stress management, diet emphasizing whole foods with reduced sugar. Professional: monthly superficial chemical peels if available. Timeline: 8 to 12 weeks for significant improvement, 6 months for near-complete clarity. This framework is meant as guidance, not prescription. Your perfect routine will be unique to your specific acne type, skin characteristics, lifestyle, and preferences. The principle is starting conservatively, progressing gradually, incorporating evidence-based treatments, addressing lifestyle factors, and maintaining long-term consistency. This approach works because it respects your individual skin while following scientific principles of acne treatment. Remember, there's no single, best, acne treatment. There's only the best treatment for your individual skin. Finding that treatment requires some experimentation, patience, and willingness to adjust based on results. Most acne responds to consistent, appropriate treatment. Your clear skin is achievable with the right approach for you specifically. The ultimate lesson: acne is treatable. Whether your path involves topical treatments, professional treatments, hormonal interventions, or isotretinoin, solutions exist for your specific acne. Finding the right approach for your individual situation, maintaining patience and consistency, and persisting through initial difficulties leads to clear, healthy skin. Your acne journey is unique, but clear skin is absolutely achievable. #20 Expert Level Skin Care and Acne Treatment Guides, Part 3. Each guide, 10 to 15 minutes reading time. Guide 31, Acne Scar Treatments, Comprehensive Guide to All Scar Types and Advanced Therapy Options. Acne scars represent permanent reminders of severe acne, but modern dermatology offers numerous treatment options that can significantly improve scarring. Understanding different scar types, appropriate treatments, realistic outcomes, and combination approaches enables you to effectively address post-acne scarring. Acne scars exist in 3 primary morphologies, each requiring different treatment approaches. Ice pick scars are deep, narrow indentations resembling puncture wounds from an ice pick. These scars have sharp edges and typically measure 1 to 4 mm in diameter but penetrate deeply into the dermis. Ice pick scars are difficult to treat because their narrow base makes many standard treatments ineffective. Boxcar scars are wider depressions with relatively flat bottoms and sharp, vertical edges. These scars typically measure 4 to 6 mm or larger in diameter. Boxcar scars appear similar to chickenpox scars. Rolling scars are shallow depressions with sloping, rounded edges creating a wave-like appearance across the skin. Rolling scars often appear worse when skin is stretched due to their tethered nature. Understanding scar depth and type guides treatment selection. Shallow scars are often more responsive to surface treatments, while deep scars require deeper penetrating treatments. Mixed scar types within the same individual require combination approaches. prevention remains the gold standard scar treatment. Avoiding picking, squeezing, or extracting acne prevents scarring. Treating acne aggressively to minimize deep inflammation prevents scarring. Tap water or filtered tap water is typically adequate. Unless you have specific water quality concerns, tap water is fine. Some people promote alkaline water for acne, claiming it reduces inflammation. However, your stomach acid immediately neutralizes any pH changes from drinking alkaline water, so drinking alkaline water doesn't meaningfully change your body's pH or skin conditions. Alkaline water claims are largely marketing. Herbal teas and other beverages contribute to hydration alongside water. Coffee and other caffeinated beverages have mild diuretic effects but still contribute to daily hydration. However, excessive caffeine consumption can worsen acne through stress and inflammation, so while counting toward hydration, caffeinated beverages shouldn't dominate your fluid intake. Hydration from food contributes to overall hydration. Fruits and vegetables contain significant water. Eating water-rich foods like watermelon, cucumber, lettuce, and citrus fruits contributes to hydration alongside drinking water. Relationship between hydration and acne typically takes 2 to 4 weeks to manifest. Improving hydration from dehydrated state to properly hydrated state might improve acne noticeably. However, increasing hydration beyond adequate amounts typically doesn't further improve acne. The practical approach: drink enough water to maintain adequate hydration, pale yellow urine, no thirst, distribute intake throughout the day, use lukewarm water for cleansing, and if you have hard or highly chlorinated water concerns, consider filtering. Hydration is one component of comprehensive acne management but not a standalone cure. Guide 36, Gut Health, Microbiome, and Emerging Research on Gut-Skin Axis. Emerging research increasingly implicates gut health and microbiota composition in acne development. Understanding gut-skin axis mechanisms and implementing strategies to support gut health offers another angle for acne management. The gut microbiome, the trillions of bacteria colonizing your digestive tract, influences systemic health including skin health. A healthy microbiome supports immune function, intestinal barrier integrity, nutrient absorption, and inflammation regulation. Microbiome dysbiosis, imbalanced bacterial composition, contributes to systemic inflammation, impaired immune function, and intestinal permeability, leaky gut, all of which correlate with worse acne. Several mechanisms link gut dysbiosis to acne. First, dysbiosis allows pathogenic bacteria to proliferate, producing lipopolysaccharides that trigger systemic inflammation. This systemic inflammation worsens acne. Second, dysbiosis compromises intestinal barrier integrity, allowing bacterial lipopolysaccharides and undigested proteins to enter circulation, further triggering inflammation and activating immune responses. Third, dysbiosis impairs production of short-chain fatty acids, butyrate, that support intestinal and immune health. Fourth, dysbiosis impairs estrogen metabolism in the gut, potentially contributing to hormonal acne in women. Several dietary factors contribute to dysbiosis. Excess sugar promotes pathogenic bacteria growth. Processed foods low in fiber and high in additives promote dysbiosis. Insufficient fiber intake results in inadequate short-chain fatty acid production. Excessive omega-6 polyunsaturated fat relative to omega-3 PUFA promotes inflammatory bacteria. Chronic stress, sleep deprivation, and certain medications, particularly antibiotics, also contribute to dysbiosis. Supporting gut health involves dietary modifications. Increasing fiber intake through whole grains, vegetables, legumes, and fruits promotes beneficial bacteria that produce short-chain fatty acids. Increasing omega-3 fatty acids relative to omega-6, eating more fish, walnuts, seeds, reducing processed food, supports beneficial bacteria. Consuming prebiotic foods, foods that feed beneficial bacteria, like asparagus, onions, garlic, and resistant starch supports beneficial bacteria growth. Fermented foods containing live bacteria provide probiotics supporting gut health. Yogurt, kimchi, sauerkraut, miso, tempeh, and kombucha all contain beneficial bacteria. Regular consumption of fermented foods supports diverse microbiota. However, benefits are modest compared to overall diet quality and should supplement rather than replace dietary improvements. Probiotic supplements provide concentrated bacteria claimed to support microbiota. However, evidence for probiotic efficacy is mixed and varying. Some people benefit noticeably from specific probiotic strains, while others see no benefit. If interested in probiotics, choosing high-quality products with documented effective strains, like Lactobacillus and Bifidobacterium species, and consulting your healthcare provider is reasonable. Probiotics for acne-specific benefit remain researched, not definitively proven. Avoiding unnecessary antibiotics protects microbiota. When antibiotics are necessary for infection, taking them is appropriate. However, demanding antibiotics for viral infections, which antibiotics don't treat, harms your microbiota unnecessarily. Using antibiotics only when truly needed protects long-term microbiota health. Managing stress supports microbiota health. Stress promotes dysbiosis through multiple mechanisms. Implementing stress management supports both gut and skin health through this mechanism. Adequate sleep supports microbiota health and is one of the highest impact microbiota interventions available. Most microbiota disruption occurs with sleep deprivation. Prioritizing 7 to 9 hours nightly supports microbiota health. Exercise supports beneficial microbiota diversity. Regular exercise promotes beneficial bacteria growth independently of diet. This is one of the many benefits of consistent exercise. Alcohol, particularly excessive consumption, harms microbiota. While occasional moderate alcohol consumption probably has minimal microbiota effects, chronic excess consumption disrupts microbiota significantly. Smoking harms microbiota, contributing another mechanism through which smoking worsens acne. Implications for acne management. While microbiota science is still emerging, supporting gut health through diet, fiber, whole foods, limited sugar, omega-3 support, probiotics potentially, though evidence is mixed, stress management, sleep, and exercise likely support skin health through multiple mechanisms including microbiota effects. These interventions support overall health beyond just acne, making them worthwhile even though direct acne benefit is still being researched. Guide 37, Hormonal Testing, Evaluation, and When to Pursue Endocrine Assessment for Acne. For women with hormonal acne, pursuing endocrine evaluation can identify underlying hormonal imbalances enabling targeted treatment. Understanding when hormonal testing is appropriate, which tests are relevant, and how to interpret results guides effective management. Hormonal acne patterns suggest hormonal involvement warranting evaluation. Acne appearing primarily on the jawline and chin, concentrated in the lower face, often indicates hormonal acne. Acne worsening cyclically around menstrual periods strongly suggests hormonal involvement. Adult acne onset, particularly after the teenage years, is often hormonal. Splashing from cooking, increasing sweat production and skin irritation. Heat exposure worsens acne. These workers need frequent face cleansing and good ventilation when possible. Outdoor workers, construction, landscaping, etc., experience sun exposure, heat, dirt, and sweat, multiple acne-promoting factors. Aggressive sun protection and sweat management are important. Office workers with high stress loads might experience stress-related acne. Stress management helps. Sports coaches and trainers are often in hot environments with sweat and frequent manual labor. Prevention strategies similar to athletes apply. Makeup artists and beauty professionals might have acne from product exposure or allergic reactions. Using quality, non-comedogenic products and maintaining clean equipment helps. Understanding your profession's specific acne-promoting factors allows targeted prevention. Many occupational acne factors can't be eliminated, can't stop wearing masks as healthcare worker, can't avoid heat as chef, but adapting treatments and prevention to account for occupational factors helps maintain clarity. Guide 76, Acne Myths and Misconceptions, Separating Fact from Fiction. Numerous myths about acne cause misinformation and sometimes harm. Understanding common myths helps you avoid misinformation affecting your treatment. Myth: acne results from poor hygiene. Fact: acne isn't caused by dirty skin or poor hygiene. Gentle cleansing is important, but over-cleansing worsens acne. Acne results from follicular occlusion, sebum production, bacteria, and inflammation, not dirty skin. Myth: chocolate causes acne. Fact: chocolate itself doesn't cause acne. However, high-sugar foods, which chocolate often contains, might worsen acne in some individuals through blood sugar and insulin effects. Myth: greasy foods cause acne. Fact: eating fatty foods doesn't directly cause acne through dietary fat transfer to skin. Excess calories from any source might contribute to inflammation and acne, but greasy foods specifically aren't acne-causing. Myth: acne will go away on its own eventually. Fact: some acne improves with age, but many people experience persistent acne requiring treatment. Waiting for spontaneous resolution wastes years. Myth: toothpaste treats acne. Fact: toothpaste isn't appropriate for acne and contains irritating ingredients. While older formulations sometimes contain benzoyl peroxide in tiny amounts, modern toothpastes shouldn't be used on skin. Myth: picking acne helps it heal. Fact: picking worsens acne, spreads bacteria, increases inflammation, and dramatically increases scarring risk. Never pick acne. Myth: sunlight cures acne. Fact: while temporary UV-induced drying might make acne appear better briefly, sun exposure actually worsens acne long-term through inflammation and post-inflammatory hyperpigmentation. Sunscreen is essential, not optional. Myth: all makeup causes acne. Fact: while some makeup clogs pores, many non-comedogenic cosmetics don't worsen acne. Appropriate cosmetic selection allows makeup use without acne worsening. Myth: acne only affects teenagers. Fact: adult acne is extremely common and can be more severe and treatment-resistant than teenage acne. Understanding that these myths are false prevents ineffective or harmful behaviors based on misinformation. Guide 77: Acne Treatment Resistance and When to Escalate Care. If acne doesn't improve despite appropriate treatment, several possibilities exist. Understanding why treatments fail helps guide next steps. Noncompliance is the most common reason treatments fail. Using treatments inconsistently, not using them as directed, or expecting results before adequate trial time has elapsed appears as treatment failure. Ensuring 8 to 12 weeks of consistent use before concluding treatment failed is important. Incorrect treatment selection for your acne type causes apparent treatment failure. Using treatments inappropriate for your acne type, for example, using salicylic acid for primarily inflammatory acne when benzoyl peroxide would be better, results in inadequate response. Inadequate treatment strength or frequency might result in insufficient improvement. Increasing frequency or concentration, appropriately, not aggressively, sometimes converts inadequate response to good response. Combination of multiple acne factors not addressed by your current treatment might cause inadequate response. Adding treatments targeting different factors improves outcomes. Underlying conditions, PCOS, other endocrine disorders, infections, causing acne might not be addressed by topical treatments. Seeking professional evaluation for underlying causes is appropriate. Barrier compromise from overuse of strong treatments sometimes appears as treatment failure, constant irritation rather than improvement. Taking a barrier repair break and restarting with gentler approach helps. When to escalate care: if single topical treatments haven't produced adequate improvement after 12 weeks, if your acne is moderate to severe from the start, if you have signs of hormonal acne, if you have deep cystic lesions, if acne is psychologically devastating. Escalating to professional dermatology care, combination treatments, or systemic treatments is appropriate. Professional dermatology can identify why treatments aren't working and recommend appropriate escalation. Don't tolerate inadequate acne improvement indefinitely. Professional help exists. Guide 78: Post-acne skin health maintenance and prevention of future problems. After achieving clear skin, maintaining skin health beyond just preventing acne ensures long-term skin quality and prevents premature aging. Sun protection remains essential post-acne for preventing aging and ensuring any residual hyperpigmentation doesn't worsen. Sunscreen habit established during acne treatment should continue indefinitely. Barrier health maintenance prevents irritation and premature aging. Continuing appropriate moisturizing even post-acne supports barrier function. Regular exfoliation at appropriate frequency maintains skin clarity without over-exfoliating. Many people benefit from continuing gentle exfoliation, perhaps reduced frequency from treatment levels, long-term. Antioxidant skin care, vitamin C, green tea, others, support skin health beyond acne treatment. These can be incorporated post-acne for anti-aging and general skin health. Retinoids continue providing anti-aging benefits beyond acne treatment. Many people maintain retinoid use specifically for anti-aging rather than acne. Hydration remains important. Maintaining good hydration habits supports skin health long-term. Regular professional skin care, facials, peels, or other treatments, helps maintain skin quality and address any minor concerns before they become problems. Guide 79: acne education and advocacy, reducing stigma and improving understanding. Acne stigma and misinformation continue affecting people with acne. Education and advocacy help reduce stigma and improve treatment access. Education about acne as a medical condition, not hygiene or lifestyle failure, reduces shame. Educating others. Many people use ketoconazole shampoo on body areas, lathering and leaving it on for 5 to 10 minutes before rinsing. Ketoconazole is gentle and suitable for frequent use. Zinc pyrithione is another topical antifungal commonly found in anti-dandruff shampoos. At 1 to 2% concentration, applied daily, it reduces malassezia and can improve fungal acne. Like ketoconazole, it's gentle and suitable for long-term use. Selenium sulfide is a strong topical antifungal traditionally used for fungal skin conditions. At 2.5% concentration, available by prescription, applied daily, selenium sulfide effectively treats fungal acne. However, some people find it irritating or have sensitivity, limiting its use in some cases. For extensive fungal acne or fungal acne resistant to topical antifungals, oral antifungals may be necessary. Fluconazole is a systemic antifungal taken orally. Typical dosing for fungal acne is 50 to 100 mg daily for 2 to 4 weeks, or alternatively, 200 mg weekly for several weeks. Oral fluconazole effectively treats extensive fungal acne and reaches areas topical antifungals cannot. However, oral antifungals can have side effects and require more medical supervision than topicals. Itraconazole is another systemic antifungal option, sometimes used as an alternative to fluconazole. Dosing and duration vary based on specific protocols and severity. Additional strategies for fungal acne management include addressing contributing factors. Wear breathable, moisture-wicking clothing. Shower promptly after sweating. Keep skin clean and dry. Use gentle, minimal skin care. Avoid heavy oils and occlusive moisturizers. Live and dry environments when possible or use a dehumidifier. These environmental modifications reduce conditions favoring yeast overgrowth. Niacinamide may provide supplementary benefit for fungal acne, as it has mild antifungal properties and reduces sebum production. Including a niacinamide product in your routine might provide additional benefit alongside topical antifungals. The challenge with fungal acne is that it can recur if contributing factors aren't addressed. If you treat fungal acne successfully but then resume wearing tight synthetic clothing in a humid environment, fungal acne may recur. Long-term management might involve occasional use of topical antifungals, weekly or monthly, to prevent recurrence. If you've been treating acne without improvement for several weeks or months, ask your dermatologist about fungal acne. A simple KOH preparation takes minutes and can confirm or rule out malassezia. Don't waste time on ineffective antibacterial treatments if you have fungal acne. Appropriate antifungal treatment provides rapid improvement. Guide 25, Acne in Different Life Stages, Adolescent, Adult, and Menopausal Acne. Acne presents differently and requires different approaches depending on life stage. Understanding age-specific acne characteristics and treatment approaches ensures appropriate management across different ages. Adolescent acne, occurring during puberty, is the most common form. Hormonal changes during puberty, particularly increased androgens, trigger increased sebum production, making adolescent acne typically more oily and comedone-prone. Adolescent acne often affects the T-zone, forehead, nose, chin, particularly heavily. Peer influence, stress about appearance, and psychological impact are often significant. Most adolescents can manage acne with topical treatments alone, though moderate to severe cases may require oral antibiotics or hormonal treatments, particularly girls. Treatment approach for adolescent acne emphasizes prevention and establishing good habits. Starting with gentle cleansing, topical treatments, and sun protection during teenage years establishes habits that persist into adulthood. Most adolescent acne improves or resolves as hormonal stability is achieved in late teens or early 20s, though some individuals continue experiencing acne into adulthood. Adult acne, occurring in adults beyond teenage years, has different characteristics. Adult acne is often more localized, jawline, chin, lower face, and frequently hormonal in nature, particularly in women. Adult acne is often more inflammatory than comedonal compared to adolescent acne. Stress, hormonal cycles, skincare product irritation, and lifestyle factors play larger roles in adult acne than in adolescent acne. Adult acne is sometimes attributed to skincare products or cosmetics, acne cosmetica. Adult women with acne often benefit from hormonal evaluation and hormonal treatments. Oral contraceptives or spironolactone can provide significant improvement. Additionally, adult women should evaluate whether acne patterns correlate with their menstrual cycle, as this suggests hormonal involvement. Adult male acne is less common than in adolescence but does occur. When it persists into adulthood, it's often quite severe and may warrant aggressive treatment including isotretinoin consideration if not responsive to standard treatments. Occupational factors sometimes contribute to adult acne. Individuals with occupations exposing them to oils, chemicals, or heat, mechanics, cooks, healthcare workers, sometimes experience acne from occupational exposure. In these cases, addressing occupational factors, protective equipment, skin cleansing protocols, helps alongside medical treatment. Menopausal acne occurs in perimenopausal and menopausal women due to hormonal fluctuations. As estrogen levels decline and the ratio of androgens to estrogen increases, acne can develop or worsen. Menopausal acne often presents as